Good Saturday morning, everyone. Today on Perspectives, as the COVID-19 virus continues to surge through the population, claiming the lives of our family, friends, and fellow Americans, the urgent need for coronavirus vaccinations has reportedly created a backlog of treatments to those who need it the most. This morning, we're going to discuss the important concerns of COVID-19. Where are we now in light of the availability of the new vaccine and the distribution of the drug to those who are in need of it most at this time? Requests for the vaccine have created now a backlog in the United States and in Alabama. The vaccines are now available, though, to essential healthcare workers, first responders, and people who are 75 years of age and older. But the system has a lot of problems. Alabama officials set up a hotline, but it has been overwhelmed by people requesting the vaccine. And there are questions as to when it would be available. Now, at last count, according to Fox 10 News, 1.3 million people had called the hotline. The problem is, though, that not all of the people calling are eligible, which is creating even more problems.
Please do not call that number unless you are a healthcare provider, a first responder, or if you're 75 and over. Also, please do not call your local hospitals trying to get in to get vaccinated, because they are now overwhelmed with calls and are having difficulty trying to just receive calls from their patient population. So I understand how frustrating this is.
Now, more on that at the end of our program this morning. Today's guest this morning is Dr. Wendy Murphy, an epidemiologist who oversees the Mobile County Health Department's Bureau of Disease Surveillance and Environmental Services. A detailed conversation on the continuing concerns about the COVID-19 pandemic when Perspectives returns after this quick break. Our guest this morning, Dr. Wendy Murphy from the Mobile County Health Department. And Dr. Murphy, thank you for joining us this morning. The United States now continuing to set records for COVID-19 infections, the hospitalizations, and very sadly the deaths as we look at the numbers. 10 months ago, did you think that we would ever be in this position?
No, absolutely not. No, I had no thought that we would be here today. You know, we have just the world's, best healthcare system, economic system, where we are world leaders, and I am surprised that the U.S. leads the world in the number of COVID-19 hospitalizations and deaths.
What went wrong, you think?
Well, I think that, we are a very sort of modern democratic society, and we hold our personal beliefs and our personal freedoms and our, constitutional rights very near and dear. It's what our country was founded on. And I think that it's hard to ask people to wear a mask for 8, 9, 10, 11, 12 months. It's hard to ask people not to gather with their families during the holidays. It's hard to ask people not to travel when, families these days are so spread across the U.S. and the world. So it's difficult to maintain things like staying at home, staying away from people for very long. And I think that's why we are seeing such an explosion of cases and deaths coming into the middle of December and January.
And you talked about some of the things that we've had to do in our lifestyles and making changes, both the mask and social distancing and removing ourselves from family and other types of events. Are you surprised at the people who are still opposed to doing some of the basic things that you're asking about the mask and the social distancing? Have you been surprised about that at all?
Not at this point. I'm not surprised. I think some of the people who don't want to wear a mask or think it's not necessary or still think that COVID-19 is a hoax. I mean, I'm not going to be able to change their opinions or change the way that they think about the COVID-19 pandemic. The only thing that might change their minds is if they get COVID themselves, or if they have a family member or loved one who gets COVID and has a severe complication or potentially dies. So at this point in the game, no, I'm not surprised that people refuse to quarantine. I'm not surprised that they, don't do more to protect themselves when they're out in the community. It doesn't surprise me anymore this far into the pandemic.
We're going to talk about the vaccine and its role in this ending of the pandemic. But before we go there, what can we do as a nation right now, other than the vaccine, to flip this thing around and to get it going down again as we had at one time?
Yeah, I mean, it's still sort of, what some people call the 3 W's: wash your hand, wear your mask, watch your distance. Those are the three big ones. Wearing a mask has been an incredible benefit this year, if not so much for COVID, for influenza and other upper respiratory viruses. I mean, they are at incredible low levels this year. So, it's a fact that wearing a mask reduces transmission. I mean, it's a fact that keeping your distance from other people reduces transmission. It's a fact that washing your hands protects you from viruses and bacterial agents. So those things are true, and we know that. So the more people continue to consistently, follow those recommendations, that's other than the vaccine and treatment to prevent serious illness, those are really still our best preventive measures.
As we look at the 3 top states, we've got 2 southern states, and Texas now number 1, Florida in the top 3, and of course California. We go further out west. Why is it happening in these 3, you believe?
Well, I think largely because they have had they've been less restrictive in people's behavior and things like gatherings and concerts and, events, that sort of thing. So, Texas and Florida for sure have been have had difficulty in the past. And again, I think it speaks to the orders or the state health directives that have been in place or lifted in those states. It's been interesting in California because they also had some pretty relaxed restrictions until recently when, some areas got so bad that they started to, issue restrictions again. So we may see this going forward where, it'll be sort of a repeat of what we saw in the early summer, where we begin to perhaps, as the infections and the hospitalizations and the deaths continue to rise, we may see a layering or a re-implementation, a staged process of maybe, implementing some restrictions in the same way that we did beginning late spring and early summer. And then as things start to get back under control, then we would, in a stepwise fashion, then release or relax those restrictions. I don't expect that that's going to happen, but that's the way we controlled it in the summer, the way that we flattened the curve and delayed the peak so that we wouldn't, overwhelm our healthcare systems. If we don't get, coverage with the vaccine fast enough, that would be sort of the next public health measure to consider. But of course, all of these things have to be taken into context with, children's needs to be educated, that needs for us to keep our economy going, needs to, keep workers at work. So there are a lot of things that come into play when we start, thinking about public health recommendations for restricting movement or restricting, the number or size of gatherings.
Yeah, we've got some difficult decisions to make here. And when we come back after this break, we're going to talk about what some of your cohorts are saying, other health specialists, as it relates to what's ahead for us in the days to come. Also, we'll talk about how the holidays have had an impact on where we are right now today. And then, of course, looking ahead and how Alabama is dealing with the coronavirus at this time. Our guest today, Dr. Wendy Murphy, here on Perspectives. We'll be back in just a moment. Our very special guest today on Perspectives, Dr. Wendy Murphy. We're talking, of course, about the coronavirus, COVID-19. And Dr. Murphy, one of your associates in public health with the Harvard School of Public Health, in fact, is quoted as saying, "The worst, certainly in terms of hospitalizations and deaths, unfortunately, is likely yet to come." Do you agree with that, or where are we here as we're looking at it from your perspective?
Yeah, I agree with that. Everything is trending up. The number of cases is trending up. The percent positive laboratory tests is trending up. People in the hospital any given day with a COVID-19 diagnosis is trending up. Deaths are trending up. Everything is going in the wrong direction. So I definitely agree that we are definitely on the upslope of this current wave that we're in.
You know, the last time that we talked, you were looking ahead to the upcoming holidays of Thanksgiving and, of course, the Christmas and New Year's period. Now, we have made it through the Christmas and the Thanksgiving season, but are we now, the numbers that we're seeing where the records are being broken almost every day and weekly, is that a result of what happened in the Thanksgiving period?
It is. I'll give you some examples to prove my point. So the Saturday before Thanksgiving, the health department conducted a Know Before You Go community-wide testing event at 6 locations. We tested 889 people, and 30 of them were positive, so a positive rate of around 3.7%. We did the same thing this Saturday before Christmas, so just about 4 weeks later and after the Thanksgiving holiday gatherings. And we tested around 930 people, and 70 of them were positive. So a doubling of the percent positive in the community, and those samples, just in the span of a couple of weeks. Also, we know that the number of households with more than one person living there with COVID was just a couple dozen before Thanksgiving. And then, 14 days, so the incubation period after Thanksgiving, we saw more than 100 households with, more than one person with COVID living in it. So we know COVID transmits easily within households, right? That's nothing new. But when you have different households gathering together, that's when you see sort of, the explosion of transmission. So at a Thanksgiving dinner, you might have, 4 or 5 different households represented in one family gathering together. And so that creates an opportunity for COVID transmission among those households, and then it just branches out from there. Then when they go to a gathering with the other side of their family with maybe 3 or 4 or 5 households present, then there's, an additional opportunity for transmission. So we saw really high numbers in the 2 weeks, the 14 days following the week of Thanksgiving. Saw a little bit of a dip, and now we are going to see another explosion of cases after the Christmas holidays. In fact, we're already seeing the signs of that, I think, because the urgent care centers and the testing facilities around town are seeing an incredible increase in the request for testing, and we're hearing of very long lines of people waiting to get tested and shortages of some rapid test materials at some locations.
When you look at the state of Alabama, Mobile County has either been number 1 or number 2 throughout most of this pandemic time, and still today, Jefferson and Mobile 1 and 2, and the numbers are extremely high. What is it that we are not doing, or do you think that we've done a great job here and it would be worse if not for what we have done?
Yeah, I think it would be a lot worse if it weren't for the measures and the actions and the policies, things taken by the community members. I mean, everything that people are doing in the community to try to do the right thing, that has been extremely important. And please, community, continue doing those things, even though we know not everyone does. City officials, by county officials, things at the health department, the state health department. Even, our healthcare system has done an incredible job. Our nursing homes are, just doing some great work out there to try to keep the numbers low. And all of that has contributed to, a steady but a slower incline in the fall. I think that it's going to get worse, yes, but it could be so much worse than it is now if it weren't for everybody that's out there, doing their part to help us sort of, pull the collective cover over Mobile County to try to keep us as safe as we can be.
Any plans coming out of the health department to introduce something different or some other encouragement or initiative other than the vaccine that's now here to get us back to where you want us to be as relates to the percentages of those who are affected?
Yeah, we're trying to increase testing throughout the community. That's why we had a couple of those big, know before you go testing events, identifying asymptomatic positive people, and, them being aware of their positive status and, staying at home or isolating after that. That prevents between 1 and 2 additional infections. We're trying to get more testing in the community, so we test every day at our 8 locations. We're hoping to open up another walk-up rapid testing location at our downtown location so that we can provide even more rapid testing. We're starting to see an incredible increase in people wanting to get tested before they travel. So in addition to the vaccine and, washing your hands and wearing your mask and watching your distance, getting tested is a really important component to try to identify people who are infectious and make sure that they don't spread infection unknowingly to other people. We hear that the science says that about 50% of COVID infections are caused or have an unknown source. So that's generally people in the community who don't know that they're infectious and spreading COVID to others. So the more we can do to, increase testing, I think we'll do better going forward. People can know that they're infected and stay at home and follow those guidelines as well. But we really are not going to see anything close to the end of the pandemic until we're able to get 70% or so of the population vaccinated.
And let's talk about that.
And that's going to take many, many months.
Yes. And let's talk about that. The vaccines are here. And did you get as much as you thought you'd get on the first end? And how is the process now working with those who you are vaccinating?
Yeah, it's really interesting. There's quite a process to go through with the state health department immunization registry. It's called Imprint. So any provider can, log on to Imprint, get an account, sign up to be a COVID provider. But it's a rather, it's not an easy process. You have to get some documentation together. You have to demonstrate that you're able to keep the vaccine at the right storage temperature. So there are some steps. So we had gone through those steps, as did lots of other particular hospitals and lots of other places. So we put in our order for a rather large amount. If we need to vaccinate, 70% of 413,000 people in Mobile County, that's a lot of vaccine, but, the hospitals are vaccinating and everyone is. But for us, for Mobile County, when we put our order in and we were approved that we were eligible to receive vaccine, what happened was when the feds told the state of Alabama how much vaccine they were going to receive when Alabama got their allotment, then Alabama went through everyone who was already approved to receive the vaccine and allotted vaccine to people who were approved. So we didn't get anything close to what we had requested. We got 500 doses, and that has been a good start for us because, there are special storage requirements. There are priorities for giving vaccines. So this is right now for us a fairly manual process, and I think for the hospital as well. So we have been giving vaccines to the priority groups outlined by the Advisory Committee on Immunization Practices and the Department of Health.
Dr. Murphy, we're going to take a break on that response, and when we come back, we'll talk more about where we are and, of course, where we're going here with this coronavirus in our local community as well as in our state. Our guest again, Dr. Wendy Murphy, Mobile County Health Department. We'll talk more here on Perspectives in just a moment. We're going to talk to Dr. Wendy Murphy today about the coronavirus and COVID-19 here in our community. As we close this out, Dr. Murphy, what do you want us to do as you are talking to Mobile County right now on the program?
Yeah, we're still asking for community members to do their part to help us curb the epidemic and slow the spread. So wear your mask, wash your hands, watch your distance. Please try to avoid gatherings of people outside of your household. Again, just keep yourself safe with that distance and mask wearing, and please get vaccinated when it's your opportunity to do so. Vaccine is going to roll out slowly. We get lots of calls every day, people wanting vaccine. We hear you. We're preparing. We're vaccinating as quickly as vaccine becomes available to us. So keep your eye on vaccinefinder.org. When there is a vaccine available to the public, you'll be able to see it there. And when someone calls you to say it's time, we have vaccine for you, please take the COVID vaccine. It's proven to be a very safe and effective vaccine against COVID-19.
Dr. Mindy Murphy, we thank you so much for spending this time with us and sharing the information that we all need to be aware of. And of course, the awareness of the vaccine is now in Mobile County, and hopefully here in the first half of this year, that 70% mark will be reached, as you were speaking of, the numbers that we need to have of the 400,000 people in Mobile County. Thank you so much for being with us this morning on Perspectives.
Good to see you, Eric.
And again, here's some important information regarding the availability of the COVID-19 vaccine. And again, this only applies at this time to a certain group. Now, if you're a healthcare provider, a first responder, or if you are 75 years of age or older, then you can call the phone number you see there on the screen. And again, that number, 855-566-5333. Now remember, the hotline set up by the state of Alabama has been overwhelmed by folks wanting to get the vaccine. The goal, though, is to make it available to all who want it in the coming months. But right now, this number is for the priority people as mentioned. So if you do not meet this criteria, you're asked not to call until it opens up for other groups. Now, next Saturday morning on Perspectives, millions of men and women and children become victims every year. Now, the majority of its victims are women, 70%, and females are even more at risk in communities where their worth is considered of little value. Now, they are manipulated or coerced into the sex trade, forced labor, and or domestic servitude. January is National Human Trafficking Awareness Month. And coming up on Perspectives, we'll find out how prevalent it is in the United States and, most importantly, here on the Gulf Coast. We'll also dispel some myths and discuss the facts and how COVID-19 has made children even more vulnerable. So please join us here next Saturday morning at 9 a.m. for Perspectives as we discuss important issues and seek solutions. Of course, if you have ideas, drop it to us here at Fox 10. I'm Eric Reynolds. Have a great week.
Thanks for watching Fox 10 News. Watch us live wherever you are, on our website, our mobile, and on our streaming news app. You can also watch us on Roku, Apple TV, and Fire TV.